I'm really pleased, firstly, to introduce to you Dr. Maria Loades. Now, Maria is a clinical psychologist by training, but is also a senior lecturer and a clinical tutor at the University of Bath. So I'm really pleased to hand over to Maria now.
Thank you, Emily, and thanks everyone for joining today. I'm just going to share my screen with you so that you can see my PowerPoint presentation. Emily, give me a thumbs up if that's come up. Brilliant. Thank you. So what I'm going to be focusing on today is thinking about social isolation and mental health in children and young people. So let me just see if I can move forward in my slides. Okay. So let's begin with some principles from developmental psychology, which are really going to be the foundations for the rest of what I'm going to say today. So firstly, it's important to remember that friendships are really where we develop and refine our social skills. But friendships and social life look different at different stages of development. So for pre-primary school children, they mainly play alongside each other, while at primary school age, friends start to become more important. So at primary school, play is still the main way through which children connect with each other, and family relationships are still really the main influence on development. But as we move into the teens, what we find is that friendships take on a much greater importance in terms of our identity and our sense of belongingness, much more so than family indeed. In the teenagers, the peer support network is really crucial, and having shared experiences with friends and others is really important in terms of development. It's a way that we test out different roles, different ideas, different experiences, and it's a way that we begin to do things that are different to our families of origin, and therefore is a crucial part of moving towards independence. The second really important thing to remember is that our ways of making sense of the world also develop over the course of childhood and adolescence. As children, we understand the world and the things that happen to us in more simple and concrete ways. And then as we move into our teenage years, we develop that ability to think in more abstract and complex ways. So really important to just hold on to those two things while we think through today. Now, I know that we've all had lots of new terms and definitions thrown at us over the last few weeks. So I just wanted to clarify what I'm meaning by some of the words I'll be using today. So social isolation in our current COVID-19 context is about keeping separate people who've got symptoms of a disease that we want to contain. And quarantine means keeping separate those people who we think might have come into contact with that disease separate. But more broadly, when we talk about social isolation, we generally mean a lack of social contacts, whether that's number of friends or how often we see them or the range of different friends we have. And the other one that's important to mention is loneliness. So loneliness is that painful emotional experience we have when our social contacts that we're actually having are different to what we would like them to be. Now, we don't know for sure, but I think it's a reasonable assumption to think that during COVID-19 and the social isolation measures introduced as part of disease containment, I think it's reasonable to think that that's going to increase loneliness, that lots of us are going to be feeling like our actual social contacts at this time are not what we would want them to be. So what we did is we've systematically searched the research evidence to find all the studies that have looked at mental health, social isolation, loneliness or quarantine in children and teenagers. And what we found is that in the disease containment scenario specifically, there's really very little evidence. So there's only one study. This study focused specifically on trauma, and it focused on social isolation and quarantine measures after or during H1N1, SARS, and avian flu pandemics in America, so including the States, Canada, and Mexico. And what it found was that those young people who were exposed to social isolation and quarantine had increased mental health usage, increased trauma symptoms. So actually 1 in 3 were experiencing significant trauma symptoms, 1 in 8 significant grief, 1 in 8 adjustment disorder, 1 in 8 acute stress disorders, and actually 1 in 20 met the criteria for post-traumatic stress disorder. And that's compared to a group who at the same time weren't exposed to social isolation or quarantine. So this is the only piece of evidence that's specifically about the impact of disease containment and mental health in children and young people, but it does suggest to us that there's a major negative impact of these measures. More broadly speaking, though, when we look at other contexts where studies have looked at loneliness and social isolation and mental health, what we find is that when these things are measured at the same point in time, loneliness is related to depression, especially in older children and especially in girls. And loneliness is also related to increased anxiety symptoms, particularly social worries and general worries. But that doesn't really tell us what to expect over time. So if young people are lonely now, what's going to happen over the forthcoming months and years? So we found a number of studies that did look at that and that measured mental health outcomes up to 9 years after loneliness. So these studies tell us a little bit about what we can expect in terms of prediction. And what it found is loneliness predicts later depressive symptoms. And I think really importantly for the current COVID context, it was particularly how long the loneliness lasted for, rather than how intense the loneliness was, that was strongly related to depression. Loneliness was also related to later anxiety symptoms. So of course, social isolation measures that are currently in place for disease containment are a necessity. But we do have really good reason to believe that social isolation and loneliness are bad for mental health. So what can we do? I think the key things are to facilitate contact with friends and important others in every which way we can. Look, I think this is where the internet has come into its own. There's so many ways we can keep in touch with each other virtually these days. So this is really what the internet was built for. I think video calls are key, and this relates to screen time generally. I think this is a good time to allow more screen time and to bear in mind that we use screens for lots of different things. Not all of those are bad, and some are really rather good. But kind of going more specifically to our developmental principles. For younger children, I think the key concern is going to be, well, why don't I have friends anymore? So it's really important to explain why children are not seeing their friends, remembering that at their stage of development, their own explanations are likely to be concrete and are likely to be self-blaming. So you may need to explain several times why they aren't seeing their friends, and also to explain that this is the same for everyone. We're all not seeing our friends at the moment. Find virtual ways to play with each other, virtual play dates, for instance. Use messages and letters, digitally or physically sent, to keep in touch. And also find ways to remind them of their friends and their networks. So drawing pictures, for example, of other people who are important to them might be really helpful. I'm trying to promote building of social skills where you can. So it might be scaffolding them to become a little bit more independent at video calls with family members, for instance. But also really important to make sure children are feeling like they're valued and belong within the family. So lots of praise for positive behaviors, which will feed more of those positive behaviors. And I think it's also crucial to keep finding ways that children can feel like part of a community. So here in England, there's been this great initiative where children have been colouring in rainbows and putting them up in their windows. And actually, it's lovely when we go for walks outside as a family. My little one can see the rainbows in other people's windows. And I think that's a great way to feel like part of something bigger in terms of community. For teens, I think the key concern is more likely to be, well, who am I without my friends, and where do I belong? So keep connections with social networks in every way possible. This is about being creative and trying to think of how can we best mirror usual interactions. That might be some one-to-one catch-ups with friends, some small group catch-ups. It might be some structured catch-ups and some more free-form catch-ups. Structured interactions where there is a specific task to do together or a game to play together or a shared interest to focus on might be especially useful for young people who find social interactions harder even at the best of times. I think it's important for us to remember that the teenagers of today are a digital generation. Look, they've grown up with screens being a constant in their lives. They're far more used to it than someone from my generation, for instance. Teens, I'm sure, have a lot of good ideas themselves about how to keep in touch. The other day I heard about virtual sleepovers, and apparently you can sync your Netflix streaming so that you can watch things together at the same time. Look, ask them, what ideas do they have, and support those ideas where possible. But I also think we need to continue to be aware of the dangers that lurk on social media, especially on open and unmoderated forums. So, those risks, they've always been there, they're no different now. And our challenge is about really enabling contact in every way we can, but also managing risks where we can. When lockdown ends, I think it's going to be really important to maximize on opportunities to re-engage socially, to re-establish friendships and to make new ones. And young people, particularly those who are more vulnerable, who struggle more with relationships, are going to need far more help and support with this than others. And I think schools are going to be a key platform for providing that. I think in summary, these are challenging times for all of us, but I'd really encourage you to be creative wherever you can in finding ways to keep in touch and to feel part of friends and networks. Admittedly, connecting virtually is not the same. It's a different sense of connection, but it's certainly better than nothing.
Thank you very much for joining us for this recording from one of our Emerging Minds webinars focused on how we can best support children and young people during this time of COVID-19 and what research can offer us. We are planning a range of webinars and you can find details of those on our website. And please do also get in touch to let us know what subjects are on your mind and what you'd like to focus on next. So a quick word about Emerging Minds. We're a research network funded by UK Research and Innovation, and members come from all sorts of disciplines and sectors, but we're all working towards reducing the prevalence of mental health problems experienced by children and young people. We really invite you to get involved, so please do sign up to keep in touch with our newsletter via our website, or keep in touch on social media, for example, Twitter. We also wanted to talk to you about a survey we are running at the moment called CoSpace. So we want to learn how families are coping with the challenges of COVID-19. So if you're a parent or a carer of a child in the school years from 0, so reception and foundation, to 11 in the UK, please do consider taking part. And your responses will really help us to find out how children, young people and their families are getting on, what's working for them, and how we can best help. Please do also spread the word to your networks and colleagues too. You can see there some of the findings that we've shared so far from the study. And on our website you can find resources particularly for parents and carers and people that work with children and young people, like the one here on the screen, about supporting children and young people with their worries. Thanks again for listening, and we hope to keep in touch with you. All the best.